Hello, my name is Melissa Daniels and I have strabismus. Strabismus is when your eyes are not pointing straight and don't necessarily want to work together. And on this channel, I talk a lot about different solutions for fixing this and overcoming. Last week, we talked about how sometimes somebody may have a traumatic brain injury and this can cause strabismus. And today I'm going to talk about some different ideas for how you can overcome that, specifically when the strabismus has come from a traumatic brain injury. Be sure to go over to strabismussolutions.com or just scan this QR code. Over there, you are going to get a lot of different resources that can help you on your own journey. If you aren't in vision therapy yet, I can help you find a vision therapy office there, or you can sign up for a Zoom call with me. When somebody is born with strabismus, it's many times like their brain just developed in a way that only uses one eye, and they don't necessarily have a lot of symptoms like dizziness or vertigo or nausea. They just only can use one eye. And this is really different from somebody with a traumatic brain injury, because usually these types of people have had both eyes working well together most of their life, and then all of a sudden something happens that stops that. And so you're usually dealing with really severe double vision, a lot of symptoms where there's just tons of nausea and dizziness. It's just a very different approach. And the types of exercises and the types of things you're going to do are going to be so different. I just want to start by saying one of the most important things is to have all the different people helping you. Physical therapy, occupational therapy, vestibular therapy, vision therapy, all of these different people. There's going to be a lot of overlap in what they might do for somebody with a traumatic brain injury, but all of it is so important. I shared this in the last video. I'll share it again. I think of a traumatic brain injury like my playroom. I currently have all of my kids' toys organized into bins that are labeled with what types of toys are in each bin. And sometimes my kids will have friends over, and these friends don't realize how psycho I am, and they'll dump all the toys out from every single bin, and it's like they just stirred it all together. And I come downstairs and there's just this huge mess. And I'm like, what happened? Okay. When you have a traumatic brain injury, it takes that organized brain, and it's like that neighbor kid who came and stirred it all. It's like your brain just got stirred up. And then comes the process of a resorting. And you know what? Like, physical therapy is going to be really good at sorting the Lincoln logs, and vision therapy can do the magnets and the dolls, right? Like, all these different professions are going to help resort out your brain, and they're going to work in different places. And yes, there's overlap and they are all helping each other. But that is one of the most important things, is to make sure you are addressing all these different parts, because your brain injury is going to affect your entire body. Now, because I work as a vision therapist, because I have strabismus, of course, my brain goes a little bit more towards the visual side of a traumatic brain injury. And that doesn't mean the other things aren't important. It's just that's not what I think about, right? Like, that's not my focus. And so, yes, go to those professionals. They're going to help you. Concussion clinics, fantastic. Love it all. Some things that we do in vision therapy that have been amazing and so impactful for people with a TBI. One is a glasses prescription, many times with a yoked prism, or some sort of what they would call like a micro prism. So with a normal strabismus, you've got this eye turn, maybe some double vision, and they'll put what they call like a compensatory prism in your glasses. So that means if your eye is turning out, they put on the prism. Prism is like a layered, you guys kind of know what prism is, but it's skinny on one side, fat on the other side. And they will arrange those so that it pushes what you're seeing out to match where your eyes are, and then you can see single, right? That's a compensatory prism. And it might be like 4 diopters or 6 diopters or 10 diopters if it's a lot. Well, with a traumatic brain injury, sometimes with these patients, they'll put in like a half diopter on one side face up, or 1 diopter in both sides, both of them going to the right. Oh my gosh, going to the left, right? So it's a totally different theory. It's not to compensate necessarily for an eye turn. It's to help like shift your world. And those can be amazing. I'm actually reading a book right now about traumatic brain injury cases in vision therapy, and so many times huge, amazing results with these different types of prism. So you're not going to get that if you just go to a traditional optometrist or an ophthalmologist. You've really got to go to a developmental optometrist, someone who does vision therapy. They're going to have that mindset when they're prescribing those glasses. So if you don't have somebody that you go to, you can go to strabismussolutions.com/findvt, fill in your information, and I will send you recommendations. So that is really important because not everyone's going to prescribe in the same way. And I would definitely want a developmental optometrist doing that. A lot of times they'll prescribe those prisms or those glasses, maybe put a tint in them, and then say, okay, go continue doing your PT and your OT for the next 6 months. Let's see how the glasses do, and then come back, and then they maybe adjust them again, and then you go back to your PT, and then you come back. It just depends on the severity. If it's super severe versus like more mild, and then they probably will eventually suggest vision therapy. But a lot of times glasses will be like that first line of defense, and they can make such a difference. It's amazing. Another thing that we'll do in vision therapy is we do optometric phototherapy or syntonics. And this is, let me grab a pair so that you can see it. They're these glasses, you put them on, and they are different filters. So like this one, can you see me through it? It's blue. Okay. There's blue, there's red, green, yellow, and I'm gonna be honest, I don't know a ton about the science of why you choose certain colors for certain people. And I will say that a lot of times people with strabismus don't respond like someone with like a traditional strabismus like me from birth. They might have a small effect. More amblyopia will be affected by these light filters. Something about like that traumatic brain injury, those people seem to really have a huge benefit from this photolight therapy. What happens is these glasses can help balance the autonomic nervous system and really help get that brain all balanced, help with visual processing, just regulating the nervous system. Your body is in this overdrive, and these glasses, the doctor will know which colors to prescribe, and that's going to help balance everything and get your brain in a more healing state. So again, this is something where they might prescribe it and say, I want you to go do these glasses for the next couple months, and then come back and we're going to check in, and then we'll start vision therapy later. So the thing with traumatic brain injury patients, like, it's just going to take such a long time. Usually this is a slow process. Think of it like a stroke rehab, something like that, where you're just like, you got to reorganize that whole playroom. It's going to take a minute. The next thing that I would recommend trying is in-office vision therapy, and this is going to definitely go in conjunction with the Prism and the Syntonics, but like a weekly intensive therapy where you are meeting with the vision therapist or the doctor every week, doing home exercises and getting those eyes and the vestibular system, like all of your systems kind of working together. Lots of eye tracking, lots of head movements, working on like that depth perception. This is a slow process, but this is going to help resort out your brain, especially if you're having a lot of visual symptoms, things like double vision and like dizziness, these different things. The vision therapy can really help. And especially if you've combined it with the other therapies, it's going to be one more piece of the puzzle that helps resort out your brain. Now, in some cases, you do all these things and you've got this eye that is just turning, and even in the very beginning, especially if you've had something where something traumatic happened and a muscle got damaged or nerve or whatever, and you've got a very significant turn, a lot of times that's going to need to be surgically addressed with a pediatric ophthalmologist who does strabismus surgery. They're going to need to fix that physical part. There's probably a lot going on with your brain too, with your perceptual system, with all these different aspects of your brain that also are going to need the vision therapy. But you've got to have like physically, like your muscles have to be in the right place in order for that healing to take place. And so surgery can be profoundly beneficial in these cases, and make it so that you have like help a lot with the double vision. If you've got a really significant eye turn, or that there's damage to a muscle, I would say, yeah, like go for the surgery. I mean, I don't know, I'm just a patient, this is just my opinion. going for that surgery, that can really help, and then following it up with the vision therapy. If you are just experiencing double vision and it's maybe minor, the eye turn isn't as significant, I would give it time. A lot of times those things are going to sort themselves out as you go through the therapy. It's all going to work out, and you are not going to actually need the surgery. So sometimes the surgery is like super important in these cases, for sure, and many times not. It's the time. It's just going to take a lot of time. If you've had a traumatic brain injury and you're experiencing strabismus and double vision, I'm so sorry. Just know that like my heart just goes out to you. Like for those like someone like me, I don't know, like I'm used to this. Like my brain has always been kind of a mess visually, so I'm really good at adjusting, and like things change and I get double vision. I'm like, oh, whatever, like it's not as big of a deal because my brain has been dealing with that since birth, and like I'm wired to deal with weird visual crap. But for someone who was wired normally and has stereo and then they lose it, it can be so debilitating. And I get that. And I'm sorry that you're going through that. I know it's hard. And especially when your eyes are straight, like people don't get it. How miserable you feel, how you like can you even get through the day, right? I get it. And there are so many other people struggling with the same thing out there, and there is help. And it is hard. It's not easy, and it's emotionally hard and physically hard, but it's worth it, and you can get that healing. You can get to a place where you can function again, and it's amazing, and it can change your life. So you can do this. I know it's really hard, but take it one step at a time. And let me know in the comments if you have any questions. I know that I am not a doctor, I'm not a surgeon, and so these are just like patterns that I've seen, things I've read in books. If you have other ideas or thoughts, I'd love to hear about them, and we will see you in the next video.